110. At what angle to the skin is heparin administered? The answer is 90 degrees. The angle to the skin that heparin is administered is 90 degrees, so think of heparin, 90 degrees for heparin. Heparin at 90 degrees, 90 degrees for heparin. Heparin at 90 degrees, 90 degrees for heparin. Heparin at 90 degrees. 111. What is the medication used to treat an overdose of heparin? The answer is protamine sulfate. The medication used to treat an overdose of heparin is protamine sulfate. Think of being overdosed on heparin, so you need a provitamin sulfate, so think of sulfate as surf. So think of a vitamin surfer swimming to you to help you treat an overdose of heparin in the shower. Therefore the medication used to treat an overdose of heparin is protamine sulfate. 112. What vital signs will indicate internal bleeding? The answer is the vital signs that will indicate internal bleeding are low blood pressure and low pulse rate. So think of internal bleeding linking with the actual blood pressure. So it is blood with blood, and also low pulse rate, which is linked from the blood, so it is all connected with internal bleeding. So vital signs and low blood pressure and low pulse rate are indications of internal bleeding. 113. What are some signs or symptoms in the patient that there is internal bleeding? The answer is some signs or symptoms that there is internal bleeding is blood in stools, blood in the urine, nasogastric drainage, bruises in dependent areas, abdominal pain, shortness of breath, chest pain, envy and dizziness. Think of obviously internal bleeding as pee and poop with blood. Nasogastric drainage, which is nosebleed, bruises in areas since it is internal bleeding, stomach pain, shortness of breath and chest pain, and dizziness and nausea and vomiting. 114. What action should the nurse take when bleeding is observed in a patient receiving thrombolytic therapy? The answer is the action that the nurse should take when bleeding is observed in a patient receiving thrombolytic therapy is the nurse will need to document bleeding, notify the doctor, and hold the medication. This is common sense. Just document bleeding ASAP and tell the doctor, and obviously hold the medication. But first is document bleeding and then hold the medication. 115. For once a day dosing of a diuretic, when should a patient take the drug? The answer is for once a day dosing of diuretic, the patient should take the drug early in the day in the morning. This is given early in the day in the morning, so he has all day to pee it out and not at night. 116. What action or interventions should be taken when a patient is on a diuretic? The answer is check input and output blood pressure, patient's weight, which is with the same scale, same weight and at the same time of day, and give meds in the morning, and keep the urinal close by. Diuretics stimulate urine production, which means it causes you to pee. Therefore it causes you to pee, so be ready to check input and output and monitor blood pressure from all that peeing, which is going to have you all in balance. And give meds in the mornings to help control all that pee coming out, and also keep the urinal close by since they might pee at any given second. 117. How should a patient be weighed? The answer is the patient should be weighed on the same scale in the same clothes, and at the same time of the day. 117. How should a patient be weighed? The answer is the patient should be weighed on the same scale, then it should be at the same time you get on top of that scale, and then it is wearing the same clothes, and at the same time of the day. 118. How does weighing a patient provide information? And what is the effectiveness of diuretic therapy? The answer is think of diuretics as a diet that is used to excrete excess water in the urine. Therefore a patient should be losing around 2 libras per day in water weight. 118. How does weighing a patient provide information? And what is the effectiveness of diuretic therapy? The answer is diuretics are used to excrete excess water in the urine. Therefore a patient should be losing around 2 libras per day in water weight. 119. What are some signs that indicate a patient taking a diuretic is dehydrated? The answer is some signs that indicate a patient taking a diuretic is dehydrated is when the patient reports having muscle cramps and arrhythmias. Think about diuretics as water pills to help kidneys. So some symptoms would be not being hydrated. And what happens when you are not hydrated? Cramps. So muscle cramps are a symptom that indicates a patient taking a diuretic is dehydrated, because he is catching cramps. Another symptom is arrhythmias. Arrhythmias is a problem with the heart rate or rhythm, so it may be too quick or too slow. Remember that arrhythmias is a problem with heart rate. So signs that a patient taking a diuretic is dehydrated is muscle cramps and arrhythmias, which is a problem with the heartbeats. 119. What are some signs that indicate a patient taking a diuretic is dehydrated? The answer is some signs that indicate a patient taking a diuretic is dehydrated is when the patient reports having muscle cramps and arrhythmias. 120. What are the signs or symptoms that the patient may have developed hypokalemia? The answer is the signs or symptoms that the patient may have developed hypokalemia are the patient may start to feel palpitations, shortness of breath, chest pain, and nausea or vomiting. So remember, the patient may start to feel palpitations, shortness of breath, chest pain, and nausea or vomiting, when possibly developing hypokalemia. Hypo means under, kalium means potassium, and emia means blood condition, so that means hypokalemia means low potassium in the bloodstream. So remember, if it is low potassium in the blood, you might feel palpitations, shortness of breath, chest pain, and nausea and vomiting. You might feel palpitations because it has to do with flow of blood to the heart. You might feel chest pain as well because it is connected to the heart. And obviously nausea and vomiting. Think of hypokalemia as anemia, which has you feeling all dizzy and with nausea and vomiting. 120. What are the signs or symptoms that the patient may have developed hypokalemia? The answer is, the signs or symptoms that the patient may have developed hypokalemia are, the patient may start to feel palpitations, shortness of breath, chest pain, and nausea or vomiting. This is because hypokalemia means too much potassium is in the blood, which means it is going to affect the blood pressure, which means there are going to be blood pressure effects that are going to lead to feeling palpitations from the heart, since there is a blood flow. Also shortness of breath from the blood not flowing, and chest pain due to the shortness of pain and palpations, so the palpations, chest pain and shortness of breath are all in the chest area. And also nausea and vomiting, which is due to the potassium overflow causing the blood to have you overflooded and not all there.